Yes, ma'am. Yes, ma'am.
Hi everybody, I'm Dr. Prashi Kaveri. Welcome to this topic on general toxicology. Here you'll be getting an insight about the entire toxicology. I'm going to give you a roadmap as to how we need to approach toxicology and some of the important questions from the same will be discussed. Now, coming to the app Auricle, now it is going to give you a 90-day university prof pre-final mastery where different subjects are going to be explained by various experts. And in today's session, I'll be explaining general toxicology. Under long essay, I'm going to explain the question of poison and I'm going to discuss the general principles of treating a case of poison and what are the duties of a doctor when a case of poison comes and gets admitted. After which, we'll move on to short essays where we will see relating agents, antidotes, gastric lavage, multi-activated charcoal, cattle poisons, homicidal poisons, and other chelating agents like DAL, EDTA, and emetics. So these are the questions which are most anticipated for the coming exams, and they have been repeated so many times. Now coming to why choose Oracle, Oracle gives you various platforms like recorded classes, live classes, practical sessions, exam mode, hard copy. So in one platform, you're going to get all these so that your preparation for exam is going to be much more easier. Coming to the recorded classes, you can watch this anytime, anywhere at your ease. You can revisit and watch them a number of times. And coming to the live classes, these are going to be conducted so that all the important questions are going to be covered and you get an insight about what might be asked in the coming exams. So here, this is a platform where a lot of students join. So you get the feeling that so many people are also studying along with you. And if you have any doubts, they can also be cleared in these sessions. Coming to the express exam module, it is created in such a way that all the important topics are covered and you get an idea about how you need to write an exam. A lot of students read a lot of things, but they do not know how to put those in paper. That's why they do not get marks. So this platform is going to teach you how exactly you need to write an answer, how you need to add diagrams, flowcharts, and all this so that your paper looks more presentable and your chances of scoring marks increases. There will also be one-to-one doubt clearing session. So this is done so that all your doubts are cleared and you do not have to fear about judgment. A lot of students in their daily classes won't stand up and ask doubts thinking that somebody might judge them. So in this platform, because all the like-minded students are studying together, you can anytime ask these doubts and get cleared. All the teachers are expert teachers who have very good experience in teaching. Therefore, this session is going to benefit all the students who are watching it. Hard copy notes are also given, and one can make utmost use of these notes. You can listen to the class and highlight all the important things that your educator says so that you know what are all important and you can focus on those points. And when you have very little time to revise just before your exams, when you have only half day or one day, you can go through those important highlighted points so that you can cover everything in the little time that is available. Question banks give you three levels of expertise learning. The first level is the basic one. After you cover this, you can go to second, and the last level is the expert level. Once you do all this, you're going to master the subject like anything. Here, these are customizable. You can put in whichever subject you're studying. And in the subject, you can add the chapter that you're studying so that you can solve the questions only of that chapter. That way, you are going to be more, it is going to be more user friendliness in the app. It is going to cover MCQs for Proff exams, NEET, as well as FMG exams. Practical sessions. There is a gap between when the practical sessions happen in your college and the time between when you're actually going to give practical exam. So this platform bridges that gap. Here you get to know there is hands-on experience about everything that's going to be asked in your practicals, and you are taken care of from your Viva OC practicals and everything in between for your practical exams. You can excel in your practical exams by watching all these videos. Now coming to our subscription plans, there is foundation plan, advanced learning plan, complete learning plan, and even ultimate MBBS plan. Coming to the foundation plan, it comes with the pre-recorded classes, live classes, exam module, practical session, and Q1. This is the basic plan, and this contains this much things, and it is valid for 3 months. Now, coming to the advanced learning plan, along with all these, there is also hard copy of the notes that is given and one-to-one doubt clearance session so that you can make the utmost benefit of it. Coming to the complete learning plan, all these are going to be given to you for a period of 1 year. So that once you start an academic year, you start with this, and as you go give your exam, this platform is going to be there throughout. Coming to the ultimate MBBS plan, this is for 4 years. Once you join this, you're covered for 4 years. Now, coming to the topic per se, the topic of general toxicology. And the first question here is define and classify poison, discuss general principles of treatment of poisoning, duties of registered medical practitioners in suspected case of poisoning. This is one of the most important questions when it comes to toxicology. There are very little 10 markers that can be asked in toxicology, and this is one among them. Now, coming to the definition. Now, whenever you write a definition, you need to highlight the key points. It is very difficult for anybody to by heart a definition. So make sure that you remember the key points. So in this definition, a poison is a substance, solid, liquid, or gas, which when introduced in the living body or brought into contact with any part will produce ill health or death or local effect. So what are important? The important things are it can be either solid, liquid, or gas, which is put inside the body, or it just comes into contact with your body. It will bring in ill health to the person. So this is going to be a definition. After which you put a classification so that your paper looks more presentable. Coming to classification, there are three types. One is corrosive, next irritants, and next is systemic. Coming to corrosive, number one thing under that is strong acids. Acids like hydrochloric acid, sulfuric acid, all these come under strong acids. Coming to strong bases, sodium hydroxide, potassium hydroxide come under strong bases. Coming to metallic salts, we have metallic salts like zinc chloride, ferric chloride, all these come under metallic salts. So this covers the corrosive part. Now going to the irritants. Irritants are of three types: agricultural irritants, inorganic irritants, and organic irritants. Agricultural irritants are those substances in which a farmer comes in contact whenever he is undergoing any agricultural work. Inorganic irritants are those like phosphorus or any metals like arsenic, mercury. All these are the inorganic substances which act as poison to the body. Coming to the organic substances, we have vegetable matter, and we can take snake bite or any other insect bite, and other vegetable, the plant poisons like castor, protein, all these comes under organic. Now coming to systemic, that under this we have to take different systems and explain. Now coming to cerebral, all the hypnotics, sedatives, antidepressants, all come under cerebral. Coming to CVS, we have drugs like aconite, nerium, odorum, all these other plant poisons which act on CVS and cause various manifestations. Coming to spinal, we need, should never forget the one and only important thing, nothing but strychnine. Next, coming to asphyxiants, we have carbon monoxide, carbon dioxide, and so many other inhalational gases that can act as asphyxiants. So whenever you put this chart, you are going to cover a lot of things in this chart. So make sure that you learn the subheadings so that you can fill it later. Now coming to the treatment, whenever a person comes by poisoning, first and foremost thing, we have to resuscitate the patient. Our primary aim should be to stabilize the person. We have to take care of the airway, breathing, circulation. These are nothing but the A, B, C of resuscitation. After which we have to put the person in a recovery position. Recovery position is a position at which the person is at maximum ease. Now, for example, if a person has consumed something, is ingested, taken by mouth and come to you, recovery position will be the one in which he is either lying laterally, left lateral, or head down, so that his mouth is lower to his larynx. What happens if larynx is above? There are chances of aspiration. To prevent that, either make him lie sideways or you make him lie backwards. That is, his face should be looking downwards and hanging by the bed. Now, coming to how you will remove all the unabsorbed poison from the body. There are different types. So it can be either inhaled, the person would have inhaled poison, or injected to himself, or he would have just come in contact with the poison, or he might have had it, ingested the poison. Now, coming to inhale, you have to do nothing but give him proper oxygen. 6 to 8 liters of oxygen should be given to the person. And if it doesn't suffice, this oxygen mask, if it doesn't suffice, you can even go for endotracheal tube intubation. If the person has injected poison, what to do? Imagine he has injected poison somewhere to his hand. You have to tie a tourniquet around 5 to 10 centimeters above the hand, and you have to loosen it once in 5 to 10 minutes so that gangrene doesn't take place. So when you tie this tourniquet, make sure that the poison doesn't spread elsewhere. Coming to contact, if he has contact with the poison, you have to thoroughly wash it with soap and then do a neutralization so that the effect of poison doesn't take place. Coming to ingested poison, if a person has taken a poison by mouth, what you can do is you can do gastric lavage. So in the picture, you can see this. This is nothing but a rubber tube which is used for gastric lavage. On one end, you have funnel, and in the center, you have a suction bulb. And then there is mouth gag and the tail part of the gastric lavage tube. Now, I'll be explaining this in depth in the next question. There is a separate question on gastric lavage. Then I'll be explaining to you how it is done. So coming to the next thing that you can do in treatment, you can give an antidote. Antidotes can be of various types. Coming to antidote, you can give a mechanical antidote. Mechanical antidote are those substances that, when given, will prevent the further absorption of the poison. Now, one is activated charcoal. As you all know, charcoal is a black powder-like thing. It is odorless, and when mixed with water, it forms a slurry. So you mix it with water and then give it through the tube to the person. It prevents all the poison gets absorbed on its surface in all the spaces that are there, so that the absorption of poison into the body doesn't take place. The next thing that you can use are demulcents. Demulcents are nothing but the food items like egg yolk or starch. These substances also form a protective coating in the stomach and prevent the further absorption of the poison. Or bulky food. If you make the person eat a lot of bulky food, this is also going to act as a mechanical barrier to prevent the further absorption of the poison. And then you can give a multi-load activated charcoal. So multi-load activated charcoal, it is a kind of charcoal. Here what happens is that you give it to the person through the tube. It goes into the lumen of the intestine. And what happens, this charcoal is going to absorb lots of poison very, very, very fast. And when it does this, a concentration gradient is created in the stomach lumen and the plasma of the person. So, initially, what happens when the person takes poison? By diffusion, from the intestine, it goes and it is there in the blood, and there in the plasma. Now, when you give activated charcoal, this charcoal is going to absorb the remaining poison, everything that is there in the lumen. So, in lumen, technically, there is zero poison now. So the concentration of poison in the plasma is more, no? So it will diffuse back into the lumen, and again the charcoal is going to absorb all this. So this is done whenever the poison is absorbed in the body in order to prevent the further ill effects. Now, coming to the examples of all these that can be used. Coming to the chemicals, the examples are like the dialyzed iron. So dialyzed iron, it is used in the poisoning of some of the metals like arsenic. Here, in chemical, whenever a question like this is asked, you need to give 2 to 3 examples so that examiner will get an idea that you know that there are certain chemical substances that can be used as treatment for poisoning. One, as I told you, is nothing but dialyzed iron, which is used in arsenic poisoning. Second example is nothing but albumin. Albumin is used in mercury chloride poisoning. Albumin will precipitate mercury chloride and it will be excreted easily from the body. The third one is nothing but copper sulfate. Now, copper sulfate also has a similar effect. In the poisoning of phosphorus, copper sulfate will precipitate phosphorus. Therefore, further absorption doesn't take place. Now, coming to the physiological antagonist. So, physiological antagonist. Now, what do you understand by the term antagonist? Antagonist is a substance which has exact opposite action to compared to one substance. So here, if poison does so many ill effects, the antagonist should be something which will reverse all those ill effects. And one of the examples for this is nothing but the very classic example that we study in pharma, atropine and physostigmine. If a person has taken too much atropine and there is poisoning, the antidote that you give is poison, the physostigmine. So the atropine poisoning, what happens? There is going to be decreased secretion, dryness, the person is going to be very, very hot, all these. No. So when you give physostigmine, all these symptoms will get reversed. And these, how does this happen? Because these act on the same nerve ending. They have the similar site of action, but the action is opposite to each other. That's all. This example will suffice here. Now coming to the next method of elimination of the poison, it is elimination by excretion. The first method is renal excretion. How do you renally excrete a poison? You make the person drink lots and lots of water, tea or lemonade so that all the poison gets washed away. This is not a very technical thing to be done because you do not know how much of the poison will get excreted. But it is a good try. Now coming to purging. Purging is you give certain substances to the person, like for example 30 gram of sodium sulfate, NaSO4, so that the person feels like vomiting and he vomits out all the poison that is there in his stomach. Apart from sodium sulfate, you can also give sorbitol. It is also a very good purging agent. The next method is whole body irrigation. Whole body irrigation is done with the help of polyethylene glycol. So this polyethylene glycol is given to the person with the help of a nasal tube, and you give the polyethylene glycol so much that until the rectal effluent, whatever is coming out of his rectum, is clear. Until then, you give the substance. Next, coming to forced alkaline diuresis. Forced alkaline diuresis is done in the poisoning of all the acids, any acids like salicylic acid or phenobarbital. In those situations, you would do this forced alkaline diuresis so that the pH of the urine becomes alkaline around 7.5 to 9, and this helps in the easy excretion of all the acids. Next, there is peritoneal dialysis. Peritoneal dialysis is done when serious amount of all the poison is consumed and it has already reached your blood. For example, if you take alcohol poisoning, barbiturate, or salicylic acid, when the blood level of poison is so much that you feel like the person might die, then that time you cannot do the simple things where little by little the poison's effect is gone. No, you have to do something so that the person is totally safe. There you use peritoneal dialysis. Same in case of hemodialysis, it is used for poisons including methanol, ethanol, and even salicylic acid, and so many other medical benefits or medical uses also. Now, coming to the next part of the question, what are the duties of a doctor? The duties of the doctor, there are two things. One, medical duty. Second, legal duty. Now, coming to medical duty. What is the medical duty of a doctor? He has to look at the patient. He has to come to a diagnosis and treat and do what is needful. As I told you, the earlier whatever we saw, right, the treatment of poisoning, all that comes under the medical duty. To identify poisoning, to do all the needy things, resuscitate the patient, and try to save his life. Now, coming to the legal duties of a doctor, he has to take the patient particulars, age, name, sex, address, all these things should be thoroughly investigated by the doctor. If the patient is not conscious, then you can ask the attendant who brought the patient regarding all these details. And then the next step is to collect samples. Because without sample, how will you identify what was the poison in case they do not know what the person consumed, right? So you have to take samples of urine, feces, vomit, whatever is coming out of the body, you take it and collect it so that examination can be done on that to find out what might be the poison that the person has ingested. Next, you have to note down the signs and symptoms. You look at the patient thoroughly. You have to do the head to toe examination and you know the symptoms, whether the pupil is constricted or dilated, or whether there are fasciculations in the hand, whether the person is having weakness, whether there is froth in near the nose, mouth, whether the person is feeling difficulty in swallowing, difficulty in talking, or is there any odor coming out of his nose. All these things has to be taken care of. And you have to make a note, you have to write it and keep so that later if you have to inform a police, you can submit all these as evidence as to what all happened to the patient. And then if you're a junior doctor, it will be your duty to inform to a senior doctor saying that this and this case has come to the hospital. Next, if the patient is not in hospital and if he is elsewhere, once you make a diagnosis of poisoning, you just called. Somebody calls you saying that near my home there is a person. He is just unwell. Maybe he consumed something and he is fainted or something. You go there, and after you get to know it's a case of poisoning, you have to shift the patient to the hospital. Next, if you're a private practitioner, you have to inform the police only if it is a homicidal case. Homicidal case is when somebody else tries to kill a person. That is when a private practitioner will tell to a police. Now, coming to what is the role of a government practitioner, irrespective of the type of poisoning, whether it is accidental, suicidal, homicidal, anything, it will be the duty of that government doctor to inform to the police. Now, this explains about the entire question. So, here in poison, I know that you cannot put any image, but what is important here is this flow chart. If you put this flow chart, the person correcting your paper will get an idea that you have understood the topic. That's why you're able to put it in this format. Next, you can put this diagram of gastric lavage. You can draw this diagram with the following labeling: funnel, rubber tube, suction valve, and mouth guard, so that your paper will look more presentable. And these are the essence of answer writing. Now, coming to the next question. It is a short answer. It is about chelating agents. Now, coming to what are chelating agents? These are the metal complexing agents used in the treatment of poisoning by heavy metals. Now imagine a person has taken something like arsenic or mercury. These are all heavy metals, right? So these chelating agents are those agents which will form a complex with that metal so that they can be made into a non-toxic form or an easily excretable form, and it will be excreted from the body and the person is safe. Now, the complex of metal and the poison is more water soluble and is excreted easily in the body. That is the prime aim of giving a chelating agent, so that the poison that is injected in the form of heavy metal can be eliminated from the body as easily and as fast as possible. Now, coming to the different types, the most important and the most widely used is nothing but British anti-leucite, which is nothing but BAL. Now, these dosage, if you don't remember, don't fuss over it. But when you are studying one or two times, you try to remember. If you cannot remember, not a very big issue. Now, the dose of BAL that is given is 3 to 4 mg per kg. This is the dose that is given. Coming to the next one, EDTA. EDTA is also a very widely used chelating agent. The dose that is used is 25 to 35 milligram per kg body weight. It is mixed with around 500 ml of 5% glucose or normal saline. So two function happens here. One, it acts as a chelating agent, and because you're giving glucose and normal saline, if there is any fluid loss and if the person has come with lot of tiredness, it is going to treat even that. You're going to give this twice daily for about 5 days. Coming to the next chelating agent, it is nothing but penicillamine. So the dose that is given is 30 mg per kg. And if the person's symptoms are not improving, you can increase it up to 2 gram per day, and you can give it in 4 divided doses for about 7 days. The treatment with penicillamine is going to be for a very long time until all the symptoms of the person tries to improve and the person feels better. The next one is DMSA. The dose is 10 mg per kg every 8 hours for first 5 days. Last one is DMPS, 5 mg per kg IV in 6 divided doses. Among all these chelating agents, the most important ones are BAL, EDTA, and penicillamine. These three are the most widely used form, and others are not that much in use. So these are used for all the metal poisoning like arsenic, mercury. Not only these, it can also be used for so many other, like iron oxide poisoning, nickel poisoning. You can use it in all those cases also. The chelating agent, remember, their major function is for metals. They complex with metals and excrete them from the body. Coming to the next question. What are antidotes? And what are universal antidotes? And what are physiological antidotes? Antidotes are the substances which counteract or neutralize the effect of poisons. So these antidotes, they have opposite action as compared to the poison. That is why we use antidotes. So coming to universal antidote, this is not in use now, okay? But for the purpose of uh, completion of syllabus and for you to understand that there was something like this that people use, you need to know this, and definitely it is going to come in your exam. That's why you need to learn this. So universal antidote consists of activated charcoal or burnt toast. Three things are going to be there at universal antidote. First one is either activated charcoal or burnt toast. You're going to take two part of it. Okay. And the second one is magnesium oxide, one part. And the last one is nothing but tannic acid or strong tea, one part. So the ratio is going to be 2 is to 1 is to 1. 4 is the total part. Two parts of activated charcoal or burnt toast, one part of magnesium oxide, and lastly, one part of tannic acid or strong tea. Earlier, what people would do is magnesium oxide, so many people would have in their house. So they used to use this burnt toast, two parts, magnesium oxide and strong tea. But later they found out that there are better antidotes available and this did not help the person that much. That's why its use has become obsolete now. So coming to physiological and antidotes. This, as I told you earlier, these act on the tissues of the body and produce symptoms exactly opposite to that of poison. And I gave you an important example of atropine and physostigmine. Atropine is a substance which will dry out. There's completely absence of sweating, absence of salivation. The eyes are going to be dry. The person is going to be very, very hot. So these are the symptoms that are seen in atropine poisoning. So when you get physostigmine, all these symptoms get reversed. How does it reverse? Because atropine and physostigmine both have action on the same nerve endings. Wherever these two things have action is same, but their action is different. That's why they're called as physiological antidotes. The other example includes cyanide and amyl nitrite. So whenever there is poisoning with cyanide, hyoscyanic acid is formed in the body after metabolism of cyanide. Now, to reverse all the symptoms of cyanide, there will be symptoms like burning throat, nausea, vomiting, convulsions. There are going to be tremors in the seen in the person, and there are also going to be other things like twitching, fasciculations. Later, the person will get hallucinations. They might go to coma. So many other symptoms of poisoning with cyanides. I'll be covering it later when the cyanide question comes. So whenever there's cyanide, you can give a physiological antidote as amyl nitrate. It is going to reverse most of the symptoms of cyanide poisoning. And these physiological antidotes are especially useful whenever some of the poison is already absorbed into the circulation. Okay, so that these can go and reverse the effect of the absorbed poison at the level of where the function occurs. Coming to the third question, gastric lavage procedure indication contraindication. This is also one of the most important questions. You can expect this in the coming exam. It is asked so many times. So when a question like this comes, firstly draw the image. So in one part, this is the tube that is used for gastric lavage. Okay, so this tube, in one part you have funnel, and then it is a rubber tube, and in the center portion you have a suction bulb, and then there is something called as a mouth gap, and another end is free end. Now, coming to the funnel, this funnel is a place where you'll be adding some substances for the stomach wash. Like you can add warm water, or you can add potassium uh, permanganate, or you can add sodium thiosulfate. So all these things can be added in the funnel. These will go to the stomach and it will act on the poison that is there in the stomach. That way the action is done. Now coming to the rubber tube, the rubber tube's function is nothing but it acts as a conduction for the substance that you put in the funnel. Then there is suction bulb. Suction bulb helps in taking out the poison from the stomach. This is the role of suction bulb. Coming to mouth gag. So there are so many people who might be unconscious. In these people, you cannot pass the tube very easily. No, in that people, you can use this mouth gag. It has a sharp end, not so sharp that it can perforate esophagus or something, but it is fairly sharp so that you can just push in the tube through the mouth and it goes and reaches the stomach of the person. The main function of mouth gag is nothing but conduction of the this tube so that it goes and it reaches the stomach. Now, coming to how this thing works. First of all, when you can do gastric lavage only when the person comes with poisoning within around 3 hours. If he comes very late, what happens is lot of poison is already absorbed into the circulation. So if you do gastric lavage also, there won't be much use. So you have to do it only when the person comes within 3 hours. This tube is technically called as an Ewald's tube. EWALDS, Ewald's tube, or it can be called as a Boas tube. And as I told you, first you put the diagram and you label it and write what is the function of each part. Now, what happens? Uh, the procedure is that you make the person sleep, and this funnel should be kept above the head of the person. And by gravity, when you pour contents for stomach wash like warm water or potassium permanganate, it goes through the tube and it reaches the suction bulb, and you give little time for the thing to act on the poison that is there in the stomach. After waiting for around 3-4 minutes, you have to hold the portion just below the funnel, around 5 centimeter, and then you have to press it when you between your index finger and the thumb finger. When you do this 5 to 6 times, it is going to be a siphoning action. What happens by this siphoning action? See, now we are pushing it like with the index and thumb, you push it, and then you bring the funnel below the person's body level. So, for example, if the person is sleeping on the bed, initially you were holding the funnel above so that you could put the content. Now you give 2 to 3 minutes time for the thing to act on the poison. Now you siphon, press the tube between your index and the thumb finger, and you bring the funnel part down below the bed. Person is here, you get it down below his body level, so that by siphoning action, all the content that is there in his stomach comes out. So you repeat this 2 to 3 times. so that all the poison in the stomach gets neutralized. You can use other substances like sodium thiocyanate, or you can also use one second. So as I told you, not only potassium permanganate, for different types of poisoning, you use different things. Uh, you can use either tannic acid, or you can use sodium thiosulfate. For each poisoning, there is a specific thing that you can use. And when you use this, it is going to neutralize the poison, and that way the poison gets excreted from the body. Okay. So this is going to be the procedure of how you need to use it. Now, coming to the indications and contraindications of a gastric flu. The indication is you can use it within 3 hours of ingestion of the poison. Because as I told you, if it is later, after 3 hours, there is absorption happening in the body, and there is not much use. And you can use this to collect stomach contents for evaluation. As I told you, by cycling action, you can collect the stomach contents, so that if you do not know what poison it is and all, you can do a lot of examination on the content and get to know about it. And for agents like salicylate acid, phenol, antidepressants, up to 12 hours you can use it, because the rate of absorption of all these will be very slow from the stomach. So these three are the agents: salicylic acid, phenol, antidepressant, where you can use this stomach tube as gastric lavage for about 12 hours. So coming to what are the contraindications. Number one, corrosive poison. Corrosives like any acids like hydrochloric acid, sodium hydroxide, potassium hydroxide. You should not use these, because there will be a risk of tear of the esophagus, because already the esophagus and the stomach tube would become very fragile because of corrosive poisoning. And when you use all these, there can be tear in the esophagus. You should not use it in a convalescent poisoning, because the action of convalescent will increase and the person might go into coma also. In comatose also you should not use, because there is a risk of aspiration. The person doesn't know what is happening, no? So all these content, when it is coming out, if there is any problem, it can go to the trachea, and he can have aspiration, he might die. In volatile poison also you should not use it, and here also there is a lot of risk of aspiration. And if there is any upper elementary disease in the form of esophageal varices, you should not use gastric lavage, because whenever you're passing this tube, all these esophageal varices can rupture, there can be torrential hemorrhage, and the person can die. Coming to next question, multi-activated charcoal. Activated charcoal facilitates the passage of substances from plasma into the intestinal lumen. As I explained to you earlier, when you give this activated charcoal, everything that is there in the intestine will get absorbed on this charcoal. And in the lumen of the intestine, technically the amount of what poison is there would be zero. And the concentration in the plasma, the absorbed portion of the poison, would be more than the intestine. And now, there is going to be diffusion happening from the plasma to the intestine, and therefore, a lot of poison can be removed. It does this by creating a concentration gradient between the blood and the bowel fluid. In the plasma, already poison is absorbed. There is a lot of poison in the plasma. In the lumen, because it gives activated charcoal, it takes in all the poison, so zero poison is there. So higher concentration to lower concentration from the blood and plasma, it is again going to come back to the lumen, and in the lumen again it will get absorbed into charcoal, and therefore the poison, the effect will get reduced. In the bowel fluid, it decreases the concentration of toxins significantly by intraluminal charcoal absorption, and significantly decreases the half-life of several drugs. Now, coming to what is the loading dose of multi-activated charcoal, it is 1 to 2 gram per kg. Now, coming to repeat doses, with one single loading dose, if you're not able to bring down the symptoms of poisoning, you have to give repeat doses. That is 0.5 to 1 gram per kg, and you have to give it once in 6 hours until the person becomes symptom free. Apart from this, you can give it in the form of continuous infusion also. If you're giving it in the form of continuous infusion, you have to give 0.25 to zero point 0.5 gram per kg per hour in a nasogastric tube. When you do this, there is going to be the action of this for a very long time and the person can become symptom free. Now coming to cattle poisons. See, what is the motive of cattle poison? It happens mostly in rural India, okay, where one person is very jealous of another person who has lots of cattle. He's making nice amount money by selling milk products, and then he's using it to plow his field. So there is one more farmer, poor farmer, who has only one or two cows. He sees this farmer so many times. He's jealous of this person, and he finally thinks that he'll kill all his cows so that he can be happy. This is one of the most common motive of cattle poisoning. Now, coming to what substances are used for cattle poisoning, you can use Arbus picatorius. This is the widely used one. Oleander, calotropis, or even other substances, inorganic substances like organophosphorus, arsenic, aconite, and zinc phosphide. Okay, lead is the most commonly used cattle poison. This is one of the image of a cattle poisoning. What happens when you give all these substances? The cattle might show very unusual behavior. That is, the cattle might just be sleeping, it won't walk, which is lying in one corner. These are the unusual behavior. Or there can be photosensitization. That is, there can be some rashes or allergy kind of thing seen on the skin of the cattle. The animal becomes sick suddenly, or even it might die suddenly without even looking sick. Okay. Now, the animal might feel difficulty in seeing anything. It might just go dash somewhere. It might lose its way, go somewhere else. There can be a lot of saliva in the mouth. The breathing can be very distressed. There can be bloating seen in the animal. The animal can have diarrhea, pain in the abdomen, and all these. It can even have convulsions, and it might even collapse and die. These can happen in cattle poison. And animals die or perform poorly after accidental ingestion of these poisons. And in some cases, gradual poison can occur in those areas wherever there can be industrial pollution. Okay. Now, as I told you, one of the most important, commonly used one is something called Arbus precatorius. No? So, Arbus precatorius is used in the form of suis. So what a SU is, these people make a paste of this Arbus precatorius along with opium, onion. They mix all this and make a paste using water and spirit. And they put these paste in they make it in the form of small needles. And they're going to take a wooden log and put two needles in that. And they're going to take this wooden log and slap the animal very hard. When they slap the animal, what happens? These two needles will get stuck on the skin of the animal, and this wooden log comes off. So nobody is going to know that something happened. But these small needles that are there in the animal skin is going to produce all the symptoms. And also these can be used to hit a person. What do they do? They keep this needle between the index and the thumb finger, or between the thumb and the index and the middle finger, and just go and slap the person so that the needle is left on the skin and your hand comes off, and this needle will do all these functions. Coming to homicidal poison. This is the next question. What is an ideal homicidal poison? So, what is homicidal poisoning? Somebody in the motive of killing another person, maybe just to kill or for robbery or any other motive, uses certain substances to kill the person. So, what will be there in the mind of the person who is trying to do a homicidal death of somebody else? That he should not get caught. So, he will use substances which are very cheap, which are easily available. It should be colorless, odorless, tasteless, so that even though later some police investigation happens, he may not be caught. That will be his motive. And these should be highly toxic, because what if he tries to kill the person and he doesn't die? He'll have to go to jail later, no? And it can be easily mixed with food items, because a lot of times homicidal poisoning happens by mixing these with food or drinks, so that the person eats and dies, and nobody, they'll be like, this person was so active, he was walking, he was talking, and suddenly he is dead after eating food. Somebody might have mixed poison. And so food is a very common medium where these poisons can be mixed. And homicidal poisons are the ideal ones are those without any antidote, so that the person dies in the first go itself. And no postmortem changes should be seen, so that the culprit will not be identified. So these, if a poison ticks all these, only then it is an ideal homicidal poison. So coming to the examples of these homicidal poisoning, there are certain examples. which are very important, like thallium. Thallium is considered to be one of the most important and ideal homicidal poisoning because people do not get to know that somebody died because of thallium poisoning. Others are arsenic, aconite, and fluoride compounds. So these four are the very important homicidal poisons. So if you get a question on this, there are any number of poisons, but the four things that should be there in your paper so that you get those extra marks are nothing but aconite, arsenic, fluoride compounds, and thallium. Now coming to BAL and EDTA. There was one previous question about chelating agents. This is also a similar question, but they've specifically asked only about this. So if a short is asked for BAL and EDTA, then each question will carry 1.5 marks. Okay. So coming to BAL, it is used as physiological antidote in case of arsenic, lead, bismuth, mercury, copper poisoning. As I told you earlier, these chelating agents are those metal complexing agents which forms a complex with metal and does eliminates from the body. So it's used in all these metal poisonings like arsenic, lead, bismuth, mercury, copper. Most of the metals have affinity to the SH group of the respiratory enzymes of the cell. That is, whenever a metal is poison is taken, for example, arsenic, it will go and bind with the sulfhydryl group, SH group of the respiratory enzymes in the cell. So these respiratory enzymes won't function. There will be failure of the electron transport chain, and the person will ultimately die out of respiratory failure. So when you give this BAL, this BAL also has sulfhydryl group. So what happens? This sulfhydryl groups of BAL combines with the metal, thus preventing them from binding with the respiratory chain enzymes. There is competition for BAL. This BAL competitively goes and binds with the metal so that metal can't bind with the respiratory enzymes and the respiratory enzymes do its function and the person is safe. The compound formed by the heavy metal and BAL is more water soluble and it is easily excreted from the body. The dose of BAL to be given is 3 to 4 milligram per kg. Coming to the next one, EDTA. EDTA is angulating agent. EDTA is a chelating agent which is used for lead, mercury, copper, cadmium, iron, and nickel poisoning. EDTA is also a metal complexing agent which is used for all these poisoning. The dose of EDTA is 25 to 35 milligram per kg body weight, and EDTA is mixed with 250 to 500 ml of 5% glucose or normal saline, and it is given IV twice daily for a period of 5 days. The treatment period with EDTA is really long. It is given for 5 days until the person becomes symptomatically better. Now, EDTA is better for treating arsenic and mercury poisoning compared to BAL. So, there are different chelating agents like EDTA, BAL, you have penicillamine. There are any number of chelating agents. Certain agents are better for certain poisons. Likewise, EDTA is better in treating arsenic and mercury poisoning, and this is also the treatment of choice for lead poisoning. Coming to the last question of today, it is emetics. So, what are emetics? Emetics are used in the treatment of ingested poison. Ingested poison are those which are taken by mouth. The number one treatment for ingested poisons is gastric lavage. In case gastric lavage doesn't work, then you can try emetics. It is used only when poisons cannot be removed by gastric lavage. The most commonly used emetic is ipecac powder, or you can give it in the powder form, or you can take 30 ml of ipecac syrup and it can be used in adults. After which you have to give lots of water, so many glasses of water until it produces vomiting. In around 90 to 95% of the patients, it produces vomiting in around 20 to 30 minutes. Dose is repeated and if vomiting doesn't occur. Earlier used emetics like mustard powder and common salt are obsolete and they can lead to various complications. See, before people would use mustard powder and common salt to cause vomiting. If a person consumes a glass of salt water, there is automatically a tendency for the person to puke it out. Okay, but salt water should be avoided because the salt water can cause fatal hypernatremia. There is so much sodium in the body that the person can die because of sodium overdose rather than the poison itself. Now, coming to what are the contraindications of these. Uh, Emetics should not be given whenever the poison is corrosive because this corrosive are doing so much harm to the body already. The intestine and the stomach tube have become so weak. Now, when you are making the person try to puke out, so there are chances that the esophagus and the stomach tears. That's why you should avoid giving emetics in corrosive poison. You should not give this in comatose patients because of the risk of aspiration. You should not give it in volatile poison, same because of the risk of aspiration. If there is any upper elementary disease like that of varices in the esophagus, it should be avoided, because when the person is forcefully trying to puke things out, these varices can rupture, there can be torrential bleeding, and the person can eventually die because of hypovolemia and shock. Whenever there is severe lung disease, and even in advanced pregnancy, giving giving these emetics is not advised. So these are going to be the contraindications. So that covers the general toxicology, all the important questions. If you write this question exam, it is going to fetch you full on full marks. And that is all for the class today. Thanks for watching, and you can download this app Auricle and benefit from this. Thank you.